Good morning. It is Thursday, September 23rd. We are going to get to the COVID numbers here in just a moment. But first, we have some order of business that we need to talk about. We know that many of you have been experiencing some difficulties with the feed the past couple of days. We just want you to hang in there. We are working through this, but we need to hear from you. We need your help. So what we want you to do is try updating your iPhone. If you've done that, it's still not working, we want to hear from you. Put it in the feed. Or if you are on another device and still having trouble, we want to hear from you. Our Facebook connection is strong. We just need your help troubleshooting what these issues are right now. However, you can still send in your questions. We are getting those, and we will ask those, and then you can go back and watch the broadcast on Facebook, on our podcast, and you can also find us on YouTube. So let us know. And right now, we want to get to some good stuff today. We got a lot of fun stuff going on today. We are following along on an incredible journey. We catch up with a few of the riders cycling all the way from Colorado to Kansas City. They are raising money for Coast to Coast for cancer. And we're going to talk about why they made this grueling trip, this big task to make a difference for so many people touched with cancer. So we're going to catch up with some of those bikers. We got some incredible stories coming up. But first, we want to get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our numbers. How did we do overnight?
Yeah, we're still holding steady in that mid-30s to low 40s number. Went down just a little bit. We should note that our last death was on September 20th, and that patient was not vaccinated. Currently, we have 35 active infections with 13 patients in the ICU and 9 on the ventilator. There's an additional 37 patients in that recovery period as well. Hays does have 8 active infections and 2 in that recovery, so a total of 10 for them and a total of 72 for us between our active and recovering patients as well.
Dr. Hawkinson, I want to ask you about something. The Kansas Education Commissioner yesterday announced that the first Kansas middle school student has died from COVID-19. We don't have a lot of details surrounding those circumstances, but we do know it's the first reported death of a child between the ages of 10 and 17 in the state of Kansas. I just want to hear from you, just your concerns. What is this telling us, and what's your message to the public?
Yeah, I mean, it's a tragedy, especially if that person, I didn't remember how old you said they were, if they were over 12 years old, who is eligible for vaccine at this point in time. We know and understand that vaccines are extremely efficacious and have a significant amount of safety as well. And we know that these things are preventable, whether it's 12 and above, 65 and above. We know that there is that continued misinformation campaign and continued voices that are uninformed by science and data and the reality of the situation. And the reality of the situation is that these vaccines are extremely efficacious. They prevent significant illness. They also, we now have seen, are able to prevent long haul syndrome. And if you are eligible, if you are 12 and above, you really should be getting this vaccine so this tragedy doesn't happen. A couple weeks ago, we saw that young high school football coach who wasn't vaccinated. Again, this would have been preventable with vaccine. So we need to continue to get vaccines to those people that are eligible. Again, I am so thankful that my children were old enough to get the vaccine at this point in time. I'm thankful my parents have got it. We know that there is a lot of anxiety from those parents whose children are younger than 12. I understand that. I feel where you're coming from. Hopefully it's just a couple more weeks, and then we'll be able to give those vaccines to those that are younger than 12 as well. But any loss of life, whether it's older patients or these younger patients, this is completely preventable. So I think we need to continue to give the vaccines. Please, if you know people who haven't gotten the vaccine or are hesitant of the vaccine, please continue to talk with them. Have them seek out sources of truth, not just sources, again, because we know there are active misinformation campaigns about the vaccine, but those are completely false. Those are uninformed opinions, not informed by the science, by the reality of the situation, by the data. These vaccines continue to be extremely safe and extremely efficacious.
Thank you for sharing that. I just think it's important to start off the show with just the reality of COVID.
Yep.
And when we talk about the loss of any life, especially a child, as we're waiting for kids to get all kids to be vaccinated. So thank you for that. I want to check in and see if there's any reporter questions on the line. Okay, we are clear of reporters for now. We're going to get to your community questions here in just a bit, but happening right now, the rubber meets the road. A passionate group, a very passionate group of bicyclists just took off from GEHA Field at Arrowhead Stadium to a huge chorus of cheers and cowbells. They are pedaling from Kansas City all the way to Indianapolis. This comes after another group. They pedaled in here to Kansas City last night, all the way from Denver, and they had some full hearts and, as you can imagine, some really sore legs. They are all Bristol Myers Squibb employees, and they are riding to raise money for cancer research. So Alexis Del Cid, she is joining us live out there at Arrowhead from the scene. And Alexis, you have some remarkable stories to share with us this morning. Let's get to them. Good morning to you.
Good morning, Jess. What a fantastic morning this is. The air is crisp, it's sunny. It's one of those gorgeous September mornings here in Kansas City. And man, the energy is just incredible out here. You saw those people driving in. There are lots of cancer survivors and people who have dedicated their lives to finding a cure for cancer. And I think that's what's really, really interesting about this event is every person out here has a common goal. At the same time, they have a very unique story. So here are two of those unique stories.
When I received the diagnosis, I thought to myself, surely this physician is mixing me up with another patient.
An accomplished marathon runner and triathlete, mother of three, Christy Williams had just celebrated her 40th birthday when her world was rocked to its core. Doctors told her she had stage 4 metastatic colon cancer. Ironically, she'd already applied to take part in the Coast to Coast for Cancer ride.
When I actually learned that I was accepted to be a rider, I was still going through treatment, and I said to myself, whatever I have to do, I want to participate in this ride.
She finished her treatment in February of 2020 and started training for the ride.
This past weekend, I rode 170 miles over the weekend.
For Christy, crossing the finish line will be bittersweet. She's celebrating her recovery, and she's also honoring the life of her cousin Jim, who died from cancer at the same time Christy was going through her treatment.
I think it's going to be an emotional ride coming into Kansas. My husband and my 3 children and my parents are going to be there waiting for me, and they were with me every step of my cancer journey, and so it's going to be emotional, but wonderful.
I'm riding for my father, who passed away of lung cancer. I'm also riding for my brother, who about 6 months after that passed away of pancreatic cancer. And that was after beating 3 other cancers.
To say Todd Franklin's family has been touched by cancer would be a gross understatement.
Even prior to that, I lost a late wife. She was the 4th straight generation to die of the same cancer in her family.
Todd has been riding up to 70 miles a day, training for his leg of the relay from Denver to Kansas City. Each rider is tasked with raising a $5,000 minimum, all of it going directly to cancer research. And even when he's at his most exhausted and sore, Todd says he finds the reserves to keep pedaling because so much is riding on it.
I would love it if my kids don't become that next generation to suffer through this disease. I'll do anything and everything I can to keep that from happening.
And man, they really are. They're doing anything and everything. Joining me now live, Christy and Todd, who crossed that finish line, joining us live to talk about how it went. Christy, what was it like seeing your family? You talked about how emotional it would be. In fact, your kiddos are standing right behind you too.
They sure are. It was very emotional. It was very much full circle for me, you know, from my diagnosis to going through treatment to making it through the ride and arriving here in Kansas City with them to greet me. It was incredible.
And Todd, you had talked about how this was your first time doing this. You were training. Were there any moments when you thought, oh my gosh, I'm not going to make it, my legs are going to give out?
Quite a few days that were like that. Thankfully, I just kept in mind my father, brother, and late wife, and remembering their fight, listening to the words come through my head saying, don't give up. So we just kept going.
What a beautiful turnout and a beautiful sentiment, and all this money that's raised to research so that one day families like yours don't have to travel this journey. What does it mean to you to see this kind of support?
It's wonderful. You know, there's so much that goes into it, from training and all the logistics and being out on the road and weather, and it's worth it because we're raising so much money for cancer research. Every penny goes to the Jimmy B Foundation, and there's just so much that's coming from it. So it's fantastic.
I want to ask you a very important question. You're in Kansas City briefly for a one-day stay, so did you have any barbecue yet?
Getting ready to go in about 2 hours.
Okay, where did you pick? I mean, there are so many choices. Where are you going for barbecue?
Joe's.
Okay.
Q39 for me.
Two great choices, Q39 and Joe's. I mean, you can't go wrong. You guys are going to have a great day here. It's a beautiful city. Thank you so much. Congratulations on beating cancer and completing your ride.
Thank you.
So awesome. Christy and Todd. Now I want to talk with Dr. Roy Jensen. Super important. You are the director of the University of Kansas Cancer Center. This event raises so much money for cancer research. Can you tell us some of the specific things that the money raised has been able to fund?
You know, the B Foundation does a great job of funding some of our younger researchers, and in particular, they have focused on the role of the immune system in treating cancer. And so some of our most exciting projects in terms of developing immune therapy for cancer have come out of the B Foundation.
You were talking about something in specific. You work towards research of using someone's own cells to fight tumors?
That's right. There's a variety of ways that you can use the immune system. One of the most exciting is to take a patient's own immune cells and use them and teach them to treat their own cancer.
That is cool. That is very cool. Well, Dr. Jensen, we're going to sign off for now. We're going to toss it back to the studio, but we want to join you later on in this program for more of your thoughts on just what this day means to you. I'm going to toss it back to Jess, who's going to take more community questions.
Alexis, thanks so much. We're going to get back out to you here in just a few moments. But yes, let's get to some community questions today, shall we? My first one is for Dr. Hawkinson. What is your barbecue of choice?
Oh,
Oh, that's a tough one. I put you on the
Is this
spot.
from the community?
This is from this community.
You know, I'm kind of partial to Arthur Bryant's, really.
You are,
I
okay.
do. I love the meat. I love the sauces. So.
Okay,
But,
so-
I mean, everything's good. Rosedale, Joe's.
You're not picky.
No.
You're not very picky with that. I get it. It's all pretty darn good, isn't it? Okay, so let's get to some questions today. Carla wants to know, she says she knows of a man that was fully vaccinated, now on a ventilator as of 2 days ago. Why do you think that is? I think a lot of questions about did the job, got the vaccine to stay out of the hospital, but now people in the hospital and on a ventilator.
Yeah, I mean, again, what we continue to see, and there's a new article out in the New England Journal of Medicine today, looking at, I think it was the Moderna vaccine, that showed continued efficacy, even after 5 months of preventing severe illness, up to 98%. But we also have to remember that nothing is 100%. This technology has been being in development for 30 years. We have seen the trial data. It is extremely efficacious and extremely safe. We have seen the real world experience, but we again understand that it's not 100%, and there are individual characteristics, but for the most part the overwhelming benefits of these vaccines are to continue to protect you against severe disease, going to the ICU, being on the ventilator. But again, it is not 100%. I don't know this gentleman's comorbidities. Did he have other problems or other issues? So again, we do have that individual, but taken as a collective, we do understand that the vaccine does continue to prevent that. And it reduces the risk of having to do that, especially in those older populations, especially for those people who are more at risk. So again, it's not 100%, but we do understand that those things do happen. We have seen that here. We have talked about that here. Now, the majority of the people that we have in the hospital that are vaccinated also have underlying medical conditions or are in that immunosuppressed state as well.
All right, Dr. Hawkinson, I have a question from Lindsay, and I'll start by saying I had a friend text me last night saying that she'd been sick off and on over the last few days and few weeks, and she said, should I get a COVID test? And I said, well, it certainly wouldn't hurt. I know I would. And I think that's where Lindsay's question's coming from. She goes, I feel we kind of on the same topic. I feel we lack information for the public as what to do if we have COVID and when to go to the hospital. When do we know? Are we getting away from people knowing when to get tested? Now that we're kind of in cold and flu season at the beginning of that, are we ignoring that? Should we be testing like we were this time last year? And just when do you know it's time? What symptoms are you having that you're like, wow, I need to get in and see somebody ASAP?
Yeah, getting back to the basics, when to test. Certainly, we know that COVID is extremely prevalent right now. So I think if you develop symptoms, go get tested. You can do the home testing. You can go to other minute clinics or things of that nature, hospital testing sites, health department testing sites. We have a testing site here at the health system as well. If you have any symptoms, it's important to go test. We know that if you've been exposed, even if you're vaccinated, you should be testing at 3 to 5 days. If you do come down with illness, again, back to the basics to the beginning, we know that the vast majority of the people who get this infection will not need to seek medical treatment. Probably 10 to 15% of those who develop the illness will have to seek medical treatment. It really comes down to that individual and how bad are you feeling? What are your symptoms? So it's really difficult to say exactly when. Certainly, if you're having increased shortness of breath, if overall you're just continuing to feel worse, increased trouble breathing, things of that nature, it's probably time to seek medical attention. But it's really difficult to center in on one exact thing. Again, you know your body better than anybody else. And so when you feel you've reached that critical point, then it's time to seek medical attention.
Okay, good morning, Isaac. His question, I know the virus isn't going away, but at what point, if ever, can a positive test in and of itself without symptoms be regarded basically as a non-event without having to isolate or do any of the things that we've been doing? Will it ever be just a non-event?
I think a lot of people, an expert opinion, virologists, epidemiologists, infectious disease physicians, would like that, would like to get to the point where we are with the other common cough and cold coronaviruses. We aren't worried about those minor illnesses. We are worried about the people that do need to seek, as we go back to the last question, that do need to seek health care, need to go to the hospital, have progressive disease going to the ICU. When will we get to that point? I don't think we really know for sure. I think we are going to get to that point quicker if we get more and more of the population vaccinated. And that is the people who are ineligible currently, so that is the children, but also those people that are eligible that haven't gotten it. Eventually, we will get to some sort of herd or population immunity. We don't understand what that will look like, but also as we go through time, and it may be decades, hopefully it will become more like the common cold coronaviruses, where, you have a little bit of sniffle, but you are still able to go do things. As far as the public health implications, when are we going to be able not to quarantine or anything like that? That's even harder to say, but hopefully overall we will develop immunity as a population or a species, just as we do with the other common coughs and colds, where we don't have to really go to the hospital, seek medical attention. Obviously, if you're sick in any employment setting, they would like you to stay home. In any school setting, if your child is ill, they need to stay home. So that's a good question. I think only time will tell. And as we get further into this and be able to vaccinate more of the population, we will get closer to some of those answers.
All right, we're going to get back out to GEHA Field at Arrowhead here in just 1 second. And we're going to take a few more community questions in just a moment. But Dr. Hawkinson, I do have one question for you.
Yeah.
Well, she wants to know, Jennifer says, besides working out, what do you recommend to decompress from the day from COVID stress? I mean, I think people think you probably have a little bit of that. So what is it that you do? Who better to answer that question than you, right?
Yeah, I think, again, this goes back to the individual and what does bring you peace. I think we need to search for peace physically, mentally, emotionally, spiritually. I think connecting with those things that do bring you peace, certainly exercise, being outdoors, just enjoying the simple things, like the wind, like the trees, the sunset. I had the opportunity to do a panel discussion at Church of the Resurrection this week, and it was a good time during the prayers before and after, just to put myself on pause, even for that little bit, and just really understand about being present in that situation. understanding where I'm at and being thankful for where I'm at. So I think it, again, continues to boil down to that individual person, and really find joy and pleasure and be thankful for those things in that present time as well.
Deep thoughts with Dr. Dana Hawkinson. I love that. Okay, great answer for that. Okay, we'll get back to you in just a few moments because we've got a few more questions we want to get to. But I want to head back out to Alexis Del Cid. She is out at GEHA Field at Arrowhead Stadium. We're going to find out more about the V Foundation. Alexis, good morning.
I'm here with, good morning, Jess. I'm here with Sherry Mazer. Sherry is in charge. She is the head, the CEO of the V Foundation. And we were just talking about how incredible turnout has been this year. After last year it was sidelined because of the pandemic, you've more than made up for it.
Yes, the cyclists this year have raised $1.5 million. Bristol Myers Squibb is matching that. So we're matching up to $500,000. So we're over $2 million in fundraising. And this will benefit life-saving cancer research through the V Foundation.
That is so cool. Now, there are a lot of people who might be watching and aren't familiar with the good work the V Foundation does. There's something really big that sets you apart from a lot of places.
We award 100% of the donations that we receive directly to cancer research. We have an endowment that covers our operating expenses so people can donate with confidence knowing their dollars are actually getting put into the hands of the scientists who are doing the work to make meaningful impacts in those lives affected by cancer.
So if someone right now donates $10, all $10 goes to the V Foundation towards cancer research.
That's exactly right. So you can donate with confidence. If you want to learn more, you can go to v.org, the letter v.org.
Sherry, thank you. That's an easy website to remember. Jess, I'm going to toss it back to you.
Alexis, I'm not letting you leave there until I have a Casey Wolf sighting. You know that,
Okay.
right? So
Okay, Casey Wolf, you know what? He's been playing hard to get. He was there when the cyclist came rolling in. He took off, so I'm going to go track him down.
Yeah, I need you to go wolf hunting immediately and bring him to me now.
He's got to do his dance.
Okay.
He's so funny.
On it.
He's so funny.
On
I'm
it.
sorry. When he's on the field, I'm embarrassed to admit. I usually
He's
watch
got the
him.
moves.
Yeah, he has the moves. I know I'm supposed to be watching, Patrick Mahomes
He's
and
got,
things
like,
like
the belly
that.
moves.
But then he shakes the belly, and I don't know. I laugh like a 5-year-old. Okay.
Moves like Jagger.
What's up? Moves like Jagger.
Yeah.
He says, Hawkinson says he's got moves like Jagger. All right, bring him to us. We want to see him before we get our day
does.
started. Okay.
Okay.
I'll be back with you in just a moment
Okay.
for some final thoughts, Alexis. Thank you. Okay, so I'm going to ask you, Dr. Hawkinson. Meg wants to know, she just wants to know if we should be avoiding indoor weddings. She's been invited to one in Texas in October. No guarantee that everyone is vaccinated. Weddings, you don't know anybody there,
Yeah.
right? You don't
100%,
know.
yep.
So what's your thoughts? I mean, now we're moving back indoors. It's
Yeah.
cold and we're moving to different states and you don't know who's vaccinated.
Yeah. Well, in that panelist discussion we had this week, we had a great guest from the Johnson County Health Department, and I would like to kick that question over to her because these are definitely common questions. And the main theme through all these answers is that it really boils down to individual risk. Our viewers are pretty well informed. They are very thoughtful about what they do. I think it's understanding what is your individual risk and what is that risk to your bubble. So the first thing to do to protect yourself is making sure you're vaccinated. The second thing, if you are going places, you can try to understand the infection dynamics in those places. And then specifically, once you get there, what are the conditions there? Is it indoors, as we heard here, or is it outdoors? Do you think, even indoors, there will be significant space to distance? These non-pharmaceutical interventions. Is masking going to at least be allowed? We know that there is a lot of consternation about masking in different parts of the United States as well. So understanding those things and then taking that into account for your individual situation as well. Can you do it safely? I think that point about, if you have a group gathering, whether it's a wedding or another party, you probably have to assume that not everybody there is vaccinated unless they are requiring it. You also have to understand how big is that party or that group gathering. Also understand that with the current spread and prevalence of the disease right now, that at least one person, if not more, as you get more people there, are probably going to have some sort of virus in their system, whether they're getting over it or they don't know they yet have it. So I think it's really important to understand those things and then make your decision based off that. Certainly we know indoor areas are more high risk than outdoors. If you can wear a mask, that will certainly give you protection. But just understanding those things and then making that informed decision based on those criteria.
Beverly is asking, can I get my third COVID immunization, her third shot? She's 65 and she's immune suppressed. I think people just wondering when they can go out and get that third dose.
Well, certainly if you fall under immunosuppressed, I would talk with your medical team or who's helping manage that, and you should have been able to get that third dosing now. We know that the third dosing is available for those people that are at least 1 month out from their first 2 doses. And again, it really looks like if you are immunosuppressed, and there's different criteria there, that really 3 dosing is really kind of considered the full vaccination status at this point. So yes, if you are and do fall under that immunosuppressed status, you can certainly go out and get that third dosing or additional dosing.
Okay, last question, then we'll get to some other questions tomorrow for follow-up Friday. Sharon has a question, another booster question. If you are older than 70, have had severe COVID, been hospitalized, had the Pfizer shot, do you need a booster as well?
Yeah, I would certainly recommend it. I think, again, initially we do have fairly good data that those people that had the infection and then got the vaccination certainly had increased levels of antibodies. What does that mean clinically? We don't fully know. But if you are in that older age group and you are 6 months or more out from that vaccine, 8 months or 12 months, you are still very well protected and you still have a high efficacy at preventing hospitalization and severe disease. But in that older age group, especially those older than 65, I would recommend when it's available and based on when you got vaccinated to get that additional dosing. I know certainly for my parents, I recommend it. But we are just waiting now for the final recommendations. And again, the only thing that has come out are those is that data for Pfizer. So I think there is a meeting or some recommendations that will be coming out today to further clarify everything, and we'll certainly be ready to talk about it tomorrow.
Catherine asked if Doc Hawk can clarify something that you had mentioned. She says, isn't the Pfizer third dose only for those people who received Pfizer originally and will only be recommended for the final, until the final info comes from the CDC?
Yep, just what I said.
Okay.
So we are only dealing with Pfizer right now. I do anticipate that the Moderna will be the same, and speculating that there will be an additional dose of Johnson & Johnson coming through as well. So those are going to be just a couple weeks behind as far as data analysis and recommendations, but I do anticipate that it will be similar to the Pfizer data. It will be similar to the Pfizer recommendations as well. But we'll wait and see.
All right, thanks for clearing that up. Okay, we're going to head to our final thoughts, and for that first, we're going to head out to Arrowhead. Is Alexis standing by? Hey, Alexis, can you hear me okay?
Hey, Jess. All right, I have been searching. I can hear you. I've been searching high and low for Casey Wolf. He knows that you're out for him, and he's playing hard to get. What can I say? I'm going to have to comb Arrowhead Stadium. However, I do have 3 adorable kids behind me.
Hey, I'll take it. I'll take it.
Kids. They're going to do their best Casey Wolf. Their best Casey Wolf impersonation, twirling around, shaking their pom-poms.
That is good
you can't
stuff.
beat cute kids.
Never, never. And Dr. Roy
There
Jensen?
you go. I also,
We'll take it.
Speaking of good stuff, we have Dr. Roy Jensen here for some final thoughts. Dr. Jensen, this is such a huge milestone for you, and what a special year it's been, marking the 50-year anniversary of the Cancer Research Act. What are you feeling now, finally being back out here after this coast-to-coast ride?
Well, it's great to have this event in person. Last year we had to cancel this event, and the V Foundation has meant a lot to our young investigators at the KU Cancer Center, and we're so glad to have that organization back up and going again.
And to have the V Foundation with 100% of the money raised going towards research, that's pretty special too.
Absolutely. Their administration is endowed, and so every single dollar that they raise goes to fund cancer research across the country.
And that ultimately helps your patients here in the Kansas City area. What a special day, and what a beautiful morning to celebrate this day on. Reporting live from Arrowhead Stadium. Back to you, Jess.
Ever been stood up at 8:30 in the morning. So yes, Casey Wolf is on my list. He knows he's my favorite. So that might be a record for me. So anyway, all right, thanks for that. Tell Dr. Jensen hello from all of us. And I'll see you back here in the studio.
Yep.
Bye, Dr. Jensen. Thank you. Okay, Dr. Hawkinson, final thoughts from you today. You've had some good stuff for us.
Yeah, no, good information coming out about Pfizer and recommendations and clarifying some of the vagueness. Again, they aren't recommending just right now or today to go out and get that if you are not immunosuppressed, but we will have more information coming out. And again, remember, there continues to be a specific and significant minority that is a loud voice for misinformation campaigns, especially for vaccination. But those opinions, those statements are not informed by science, are not informed by the data or the reality of the situation. Vaccines continue to be extremely efficacious and safe and can prevent and have a high propensity and significance of preventing these unneeded tragedies that we saw in 2020. So again, continue to encourage vaccination, continue to encourage those people that have not yet been vaccinated to go get vaccinated so we can try to prevent more tragedy moving forward.
Catherine says, Dr. Hawkinson is the best. He answered my question before I even asked
Yeah.
him. So that's how you roll. Thanks so much. Okay, so thank you all for being with us. And we have been looking at your feed today with all of your situations with the feed. So want to let you know that we're still working on that. So stay with us. We'll be back tomorrow. I have been collecting your unanswered questions for safekeeping. So tomorrow we're back with Follow-Up Friday. And we'll get to all of those. So join us back here at 8 o'clock tomorrow. Have a great day.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.